following laparoscopic fundoplication, the impact of recurrent symptoms, new symptoms, and the patient experience, from Tampa General Hospital.
Good morning and thank you. My name is Leanne Humphreys and the title of my presentation is Causes of Dissatisfaction Following Laparoscopic Fundoplication, the Impact of Recurrent Symptoms, New Symptoms, and the Patient Experience. Laparoscopic fundoplication is the gold standard therapy for GERD, though success following the operation is not entirely uniform. In our experience of over 1,000 patients, we observed nearly universal symptomatic relief related to GERD. However, a subset of patients remained dissatisfied. We undertook this study to determine the causes of dissatisfaction and to characterize the experiences of dissatisfied patients. We did this with a prospectively followed database as well as preoperative and postoperative surveys. The top table shows that there are no demographic differences between dissatisfied and satisfied patients with regard to gender, age, and BMI. Not surprisingly, we did see that patients that experience complications or that require reoperation are more likely to be dissatisfied. We looked more closely at the symptom data for the 101 dissatisfied patients and found, interestingly, even dissatisfied patients experience improvement in their heartburn symptoms. They do, however, experience new symptoms, including dysphagia, gas and bloating, inability to belch, and nausea. We scrutinized this population further and found that, in fact, new symptoms were the primary postoperative complaint for the majority of patients. This is correlated to follow-up on the right, in which new symptoms are most pronounced around the time of the operation and decrease with time. 23% of patients complained primarily of reflux recurrence, with these symptoms occurring 1 or more years postoperatively at a peak of about 5 years. Of note, however, we did see that a significant percentage of these patients had no objective evidence of recurrence. In our experience, we found that dissatisfaction is uncommon. Heartburn symptoms improved for almost all patients, though some patients did experience new symptoms, and these were the primary causes of dissatisfaction. With regard to follow-up, new symptoms were most prevalent at shorter follow-up. Recurrent symptoms generally occurred later, though there is not always objective evidence to confirm this. Thank you.
Thank you. Next presenter.